It's time for Studio 7, sponsored by your Permian Basin Chevy dealers. Welcome back. Today we're exploring cosmetic surgery and how it can help you in business. Joining us today is Dr. Vu Ho and his patient Seema Moini. Thank you so much for being with us today.
Thank you so much for having me.
Anytime. Okay, so Dr. Ho, you know, getting cosmetic surgery for professionals, it's becoming really popular right now, right?
Yes, absolutely. So today's busy professional wants to update their image, you know, stay relevant. And a lot of times they're competing with younger coworkers. So really to stay competitive, you know, updating that new look is something they're striving for.
Yeah, and so are you getting a lot of people coming in saying, I'm in sales or in the workforce and I really need to, like you said, stay relevant with your look?
They want to stay current, and it also helps, I think, with building the self-confidence and feeling better about themselves, too.
Yeah, so like you just said, confidence is so important in the workplace. Seema, you're a professional in the workplace. Tell us a little bit about your journey with Dr. Ho.
Yes, I'm very happy to meet him, actually, and I have to tell you that I didn't have any plan to do it. And one day my daughter said, Mom, I think you should do it.
Oh, yeah?
Yeah, and then I said, do you think that is that bad? And she said, no, just too refreshing to be, looks younger, and we have a big event. You're gonna look better in the picture. And I said, okay, do you know somebody? And she said, yes, I know Dr. Ho. And I said, okay, make an appointment and we're gonna go for consultation. When I went over there, I was speechless.
Yeah.
The staff that he has and the time that he spent for me to give me the different options and talk about how gonna be in future. And believe it or not, at that day I said, make an appointment for me.
Yeah.
And we did it next week.
Oh, wow.
Yes,
So you didn't have much time to think about it. You're just ready.
I was ready because the confidence that I got it when I talked to Dr. Ho. He's amazing guy. He is. And the follow-up that they do it is amazing. What makes me happy very much is when I went back to work after 2 weeks, nobody noticed that I had a plastic surgery at all. Everybody said, you lost weight, you look younger, you're so refreshed. Did you have a good vacation or something? That was very nice.
If only a vacation can make you look that good, right?
And I was so happy because I didn't want to be too dramatic and too extreme that anybody figure out and knows about it.
So, Dr. Ho, you look great. Tell us a little bit about what you did here.
So Seema has some of the very common concerns that I see a lot in the office, and that's the sagging jowls, the loose neck or turkey neck, we sometimes call it. And so the perfect procedure was going to be a lower facelift and a neck lift.
Okay.
And that really targets the jawline and it tightens up the neck, but it does it in such a natural looking way that it's just a phenomenal result.
That's the best part.
Yeah, I mean,
to look natural.
like I said, when I first saw you, I said, you look great. I can't even tell you've had anything done. I mean, when you look at these before and after photos, you can see a difference, but it's so natural. I'm assuming that's what you strive for.
Yes, exactly. We want to maintain a person's identity, just enhance them, but keep them who they are. And the other important part of it is Seema is a very busy professional. She can't afford to take a lot of time off and a lot of downtime. So we want something that will kind of give her a quicker recovery and still maintain those results that she's looking for.
Yeah, so Seema, let's talk about that. What was your recovery like?
My recovery was very fast, actually, I can tell. That took me just 2 weeks and was not bad at all.
Yeah.
If even you cut your finger, takes time to heal. You know, that's very, very normal and natural things. And the bruises that I got in my neck after 2 days was gone.
Wow.
Really was gone.
So I'm sure a lot of patients come to you, they're concerned, they might be in a lot of pain, but is it not that bad, the pain afterwards?
Not at all, because of for sure you're gonna get the pain medication. And
So
I survived.
and you look great because of it. Yeah, so that's great. Not a long downtime and not very much pain.
Not
What
at
else
all.
could you want? You
No.
look great.
Thank you.
And this is something you do a lot?
Yes, we do this type of surgery all the time. It's one of the more common procedures that I perform, and most people have it done right in the office. So it's a lot more convenient for patients, and again, without the general anesthesia, they can recover quicker.
Wow, that's awesome.
Alexa, I can say he knows what he's doing.
Yes,
Really?
I can tell.
I'm serious. And a lot of my clients, they like to have something done, but they don't want to be extreme. And now I have more self-confidence to talk about my experience to them.
Right.
And that is great.
Yeah, and
to
you're-
find Mr. Dr.
Yes, and you're an esthetician, so you
Yes.
work in beauty, so it was
Yes.
important for you.
Yes.
And
for
well,
sure.
most people know Dr. Ho, associated with Chapel Rosso Dermatology right here in Odessa. You'll have an open house coming up, right? Tell us a little bit about that.
So on September 20th, we'll be available to meet potential patients and maybe talk about any concerns that they have about their appearance and go over some options. So it'll be a good opportunity to meet myself and the staff and
Yeah.
discuss those different options.
It's a great meet and greet. Do you get people that come to you that say, I don't know exactly what I want done, but I know I need something done, and you can maybe give them some guidelines on that?
Sure, that's what I'm there for, is to take a look and see what we can do to help.
Okay. Well, I guess you can tell me after the segment what you feel like I can do. Well, thank you all so much for being with us. Again, you look great. We love having you, Dr. Ho. We
Thank you
appreciate
so
it.
much.
What?